Hello, everyone. Thank you for joining us for this last part of the series that Nicole and I are doing on mold-related illnesses and sick building syndrome. Our last part is how do you regain your health after being impacted from mold, either from a water damaged building or exposure from a workplace. Nicole, what's your thoughts in terms of regaining? Obviously, you need to get out of the building, or you need to get it remediated. And they're the number one steps. You really can't start to repair health until you've done those two things.
Exactly. I mean, your risk escalates. The longer you spend time in these toxic environments, the more your body suffers. And some people are the canaries that suffer quicker than the others, but we're all impacted at some point. So getting to the root cause is the most fundamental part of getting better, is to stop the exposures if it's in your home.
And so detox, you talked a little bit about detoxification. It is a big part. When I am recovering, there's three parts that, I classically work on, usually detoxification, immune support, and endocrine support. And they tend to be the three pathways. Obviously, the nervous system and neuroinflammation is the big driver. Can you talk a little bit about the detoxification processes? And, you touched on glutathione and those glutathione pathways being impaired.
Yes. Well, the first one is getting to the root cause and reducing the toxic load altogether by really thinking about where you're exposed. And a lot of the exposure to toxicants is going to happen from pest management. So pesticides is one of the worst.
Yeah.
Really not having any form of pesticides in or around the home. If you live within a kilometre of a golf course, you're in trouble because your glyphosate and your potentially organophosphate levels are going to be off the roof. And it doesn't matter what you do, when you increase your risk to pesticides, the most of them are antibacterial, so they affect the microbiome. So that's absolutely important that, if the GPL tox test by the Great Plains is a useful one to look at environmental. Yeah, it's really good. The other ones are personal care products, because you're putting it on your skin and absorbing high levels of toxicants through the skin. That's why your products are not safe enough to eat. Really question about putting them in. Most of the personal care products that are used are water-based, which means they have to have a preservative, and that preservative most of the time is a toxic pesticide, because pesticides are antibacterial. So you don't want your triclosans, you don't want your pesticides, your parabens, all these things, which are endemic in most women's products. So really, when it comes back to basics, go back to like the Polynesian way of, natural oils still in their natural state, your jojobas, your waxes, your, a lot of your grape seed and your seed and nut oils, providing you're not allergic to seeds and nuts. Is important. My personal care routine is shameful because I don't use anything. I use mascara and I take it off with coconut oil, and that's my entire routine, day in, day out, for months. I don't use anything on my skin except water and maybe a microfiber cloth to clean. That's it. I actually don't do anything, and I haven't for 20 years.
Gorgeous.
Not bad for my 50s.
Just have to say, darling. And so detoxification, it's avoiding the toxins wherever possible, get them out, because the system is overloaded with dealing with this mycotoxic burden. I'll often recommend like liver cleansers, kidney cleansers, and bowel cleansers. Having treated mold-related illnesses for quite a while now, I do find colonics quite helpful in that process as well.
Coffee enemas?
Yeah, coffee enemas, definitely, because they stimulate the glutathione production with the liver. And I do find patients that it's not until we bring them in that they really start to turn a corner. So number one is a lot around detoxification. Immune support. What I find interesting about the mycotoxins is that they do interfere with the proteins in the gut, particularly, which mediate that immune inflammation. And it inhibits that protein synthesis. And so one of the classic pathology tests that I'll often see is low albumins or low globulins. And I know that protein synthesis has been interfered with at a gut level. And it's one of the things that I use as a marker to know, am I mediating this immune response? Am I seeing these markers come up? And they're predominantly in the gut. So I'll often use a lot of IgG, immunoglobulins to help really rescue the immune system. Some clinics are doing that intravenously. It's hard to get though, but there are some beautiful products on the market that will just help to really build that immune reserve and help with the secretory IgA, which is that beautiful mucosal lining, that frontline defense. And the endocrine system gets incredibly affected. So I'll often use things like melatonin to try and rescue the endocrine system. I'll often use things like progesterone as well, and herbs that really help with that pituitary, adrenal, hypothalamus axis in the nervous system, and obviously anything nervous system. So I'm a huge fan of craniosacral therapy. There's some really nice vagal nerve stimulation therapy that you can use to rescue the vagal nervous system, which is incredibly infected by neurotoxins. And I really like bioresonance as well, just as a modality to help really balance the mold and the signature or the imprint of the mold on the energetic body. So I get really good results. So I usually use a team approach when I'm trying to help people recover from mold-related illnesses, and they do recover. And I guess I want to leave this just on a high note that this isn't a life sentence. We're very, very lucky, Nicole, to have people like you do the work that you've done to help us understand what we're looking at and what we're treating. Because for a very long time, we were sort of treating these conditions in the blind and we weren't getting any results. And, you know, I know it's what motivated you. You know, I had all these patients coming to me, nothing was working, didn't really know what the cause was, just knew they had all these complex chronic health inflammatory symptoms. And now we understand it. It's, you know, it really is just a process of working backwards through the systems. And patients do recover. I've seen patients have full recovery. So it is treatable. It is a treatable condition. It's not something that you just have to live with.
Oh, absolutely, definitely. And just being mindful. I mean, in many ways, this can be a blessing in a very negative way initially, because it's made them mindful about what they buy and their products they buy and the information they're being fed. So they reduce their toxic load all over, not just their home, but as you said, their diet, they clean that up, etc. And it's really, really important that they do
and
that.
their cosmetics, they clean that up too. And then their homes, and everybody everybody benefits. The family, the whole family benefits from this approach. It's not just the patient themselves. So Nicole, thank you so much for your time and for being so passionate about Australians having healthy homes, and all that you contribute to health and well-being.
Thank you so much, friend.
Bye.